this is a topic that it's in transition, because since 2006, intraperitoneal therapy for ovarian cancer has been standard, but unfortunately, it's associated with certain toxicities and also a learning curve in terms of delivery of the treatment, so that it was not being applied across the board. So the gynecology oncology group some years ago started to do pilot studies to see whether they could reduce the toxicity and retain the efficacy. And then they devised this large study, which is called GOG 252, which was just the results of this study matured enough for progression-free survival in March of this year. And lo and behold, there's no difference between a totally IV arm and the former modified standard treatment with intraperitoneal cisplatin and intraperitoneal paclitaxel, and a new arm to reduce toxicity of intraperitoneal carboplatin with IV paclitaxel. And when all is said and done, through this trial, which accrued about 1,200 patients, it led to this preliminary result, which would indicate no actual difference between the three arms so far. This progression-free, it's not overall survival. And typically, the overall survival differences in these intraperitoneal versus IV trials that the GOG did 3, the changes in overall survival were even greater than the magnitude of effect in the progression-free survival.